Okay, so today's discussion is reopening revisited. We kind of had a reopening discussion early on, and since things have been changing daily, I thought, well, let's see where everybody's at. And once I threw the idea out, Amy from Fox City said Maria would be a great person to invite in as a guest to share some of the things that are happening with the reopening procedures there. So I said, fantastic. So thank you, Amy, for the suggestion, and thank you, Maria, for being here. I'll go ahead and turn it over to you, Maria. You can introduce yourself, and I do have that document that I can share whenever you're ready to share that as well.
Okay, perfect. Well, thank you everybody so much for welcoming me into your group as a visitor. I know Amy, of course, is a regular on this format, and I'm so grateful that she helps keep the finger on the pulse and make sure that we're all working together across the state. And that was one reason why I wanted to be able to connect and just talk about, as Lonnie had said, what we're working on a national level specific to touring Broadway, so that we could open up the conversation here in Wisconsin to see how many of these things, these different ideas and protocols make sense for all of us to band together. Because what we're finding across the country is when you've got cultural gathering places, including performing arts centers, museums, all of those things pulling in the same direction and kind of coming up with a shared understanding, that language helps carry a lot more weight, and hopefully we can be a leading voice in reopening our state as opposed to a reactionary voice. So that's what we are hoping for through this dialogue and this conversation. To be very specific, I know a lot of you aren't closing, right? You are still doing productions. You're able to accomplish different live experiences through social distancing, or you have some sort of outdoor space that is allowing you to do, I know there's the very creative, drive-in performances and that sort of thing. So very specifically, what we're aiming for with these guidelines and protocols that we're getting into that we're talking about here is how do we reopen to full capacity, elbow to elbow audiences. We know that this isn't going to be overnight, because step one is the spread of COVID needs to be under control. We cannot even position this sort of conversation as our numbers are rising. So this is a little bit about timing as well. This isn't a tomorrow conversation. We're hoping that it's an early 2021 conversation at the latest. But again, as long as the headlines are reading that we're having record number of new positive cases, it's going to be really hard to have a conversation both with our elected officials, our healthcare providers, and our public, our community, in a way that they'll feel safe coming back to sit shoulder to shoulder next to a community member for 2 or more hours of live performance, right? But that is what we need to get to. So that's, I've got a very high level outline that, Lonnie, if you want to bring it up, that's the context that this outline was put together. And what's happening with this very high level outline is that this is serving as a basis for conversations both nationally with the different unions, Actors Equity, IATSE, the Musicians Union. It's also something that I think is a good conversation tool, not only amongst ourselves as live venues, but it also, I found it very helpful when I'm talking to for example, our City of Appleton public health officer, as I'm talking to our local healthcare epidemiologists and our mayors and our county healthcare providers. This kind of just gives a very high level of, these are some of the things that we're thinking of putting in place to get their feedback, their buy-in, and to make sure that we're thinking of all the right things. The other caveat that I'll say, this sentence underneath the heading is a really important sentence because we all know we're learning so much about this virus that things are changing. What we know about how the virus spreads and how to prevent the virus is continuously evolving. So the big thing that the conversations that I'm having is, I don't necessarily think that it's wise to get completely locked into a set of solutions today, if we're not talking about reopening until December, January, because things may change. So you'll notice on here that we've put kind of this disclaimer statement at the beginning that says that the guidelines are really based on current CDC and WEDC recommendations. They're subject to change, and then we're putting a current as of date so that as we learn more and we recognize that there's an opportunity to revise these guidelines, we know which is the most recent version that we're working off of, but it gives us that opening to say, you know what, yes, in August we thought sanitizing all spaces was absolutely important, but now by January we've learned for sure it's not spreading by contact on surfaces, right? So maybe that goes away. So it's those sort of things we want to make sure that we're allowing ourselves the flexibility to be open to those changes. What this document does is it breaks down into segments. So you'll see this top part that we're looking at is what we need to do from a venue perspective. What are some of the actions we can take to make sure that our buildings are staying as healthy as possible? And then we've got audience, and then we've got the backstage side. So if we start with the venues, I'm imagining none of these things are new to any of you. I would imagine a lot of you have heard about these things. You're talking about these things. So we're talking about the enhanced hygiene of our spaces, how much we have to clean and deep sanitize our spaces in between events, making sure that hand sanitizing stations are available very, very openly to all of our audiences, staff, and volunteers who are in the building. There's a lot of conversations about HVAC systems and what we can do as far as filtration is concerned to get fresh air into the building and to be removing the less recycling of the air and more fresh air in. And I realize for some historic venues, this could be an issue. So that's why you see reviewing the HVAC systems. And I think that that's a conversation that needs to be had. Building specific, what are the capabilities to the building? What is possible? What makes sense? And then you'll see this when feasible, maximizing touchless environment as much as possible. Again, not everybody can go through and pull out all of their toilets and replace them with automatic flushing toilets, right? So there is this reality of we've got to go through and see what is practical and what we can do, but at least to have a checklist in your mind of things that we can be looking at. Let's see, and then we've got how posting information for our attendees as far as making sure that we're always informing our attendees, our staff, our volunteers, everybody about the best known information about mitigating the spread of the disease. There's a lot of conversation right now about whether or not what kind of screening should be put in place for audiences. And this is a big, big point of contention. For any of you who have seen IATSE and Actors Equity, they've put out their statements of what they are putting on the table as far as requirements before they'll return to work. And they both include frequent rapid response testing, which is a real concern. It is a real concern, especially in the state of Wisconsin, because in Wisconsin, I guess depending where you are a little bit, right? I think those of you who are in the southeast area of the state, Milwaukee, Madison area, you may have more access to testing, but I know here in the Fox Valley, in the Fox City specifically, we don't even have enough tests for people who are presenting with symptoms. We're sending people to Oshkosh or Green Bay right now for tests. So, so across the state, that could be an issue, and that's another reason why if we band together as a consortium and say, hey, we need access to this, together we're going to have more clout than if we're just individually one-off performing arts center at a time trying to scrounge for what we can get our hands on. So the testing is something I'm keeping a really close eye on because I think that that is evolving a lot. If we were having that, and when you had this conversation earlier, like in April or May, especially April, a lot of the focus was on temperature checks. And now the science has moved to a point where we know that temperature checks really aren't a great screening tool because not everybody presents with a temperature. So it's really interesting to see how that conversation is evolving and will continue to evolve. So that's kind of the high level there. And Lonnie, I don't know if you want to take this by section and then open it up for questions, or if we want to kind of go through the whole thing and then open it up? What is the group's preference?
You know, I guess if you're willing, maybe we can pause and take questions each section. So
Absolutely. And I do want to say, Tim Sowers at the Overture, Tim has been working on this with me quite a bit. So Tim, if there's anything I'm missing, please feel free to jump in.
One second, I'm figuring out how to get my participants back here. Well, hang on, let me just do this. Okay.
I was going to say, I was trying to scroll through it. I wasn't seeing anybody. Oh,
okay.
John, do you have a question?
Does anybody have any questions at this point?
I guess the real question, oh, I'm sorry, Tim, go ahead.
The only thing that I want to say to just back Maria up on this is the importance of getting this in front of legislatures, and for us to, as she said, be the proactive voice and not the reactive voice. And if you look down the whole list of all of this, we're not guaranteeing anything, really. We're saying if feasible, if that, and you're going to notice like somewhere on the venue list, we don't say anything about social distancing.
Right.
Because everybody's sitting next to each other in the theater. Right? Now, if they're all requiring to wearing masks, maybe it's going to affect concessions, right? But just to keep that in mind on how kind of loose this is, that's all I want to say. Thanks, Maria.
Thanks, Tim. Anybody else have any questions at this point? If not, we'll go on to the next section.
I do see a question here about the health coordinator position. It is interesting. I do think that it's wise to be a paid staff member when possible, just because of the level of responsibility and the confrontations they may be positioned to get into. And I always get a little nervous about putting a volunteer in that position, but it's going to depend on how your organization is structured a lot too, right? Where that's appropriate. There are some larger performing arts centers across the country. I think about ASU Gamage, for example. They've actually hired a full-time position where this is their job. We're not going to be able to do that. This is going to be another "and" added to someone's title. Right now, I envision it being with our safety officer. It will now be a health and safety officer position, because I envision a lot of the screening having to align with whatever security screening we've been working on putting in place in the last couple of years. So I see some alignment there where our manager, who has been charged with those security screenings in the past, now may also be in charge with enforcing these screenings. Now, that's really important for again, a smaller organization like us. They're not writing this policy, they're not creating it, but they will be the ones who are responsible for overseeing and making sure that it gets executed, because it's a manager level position.
That's how we're looking at it too, in that same area. Yeah.
Okay. Yep. Any other questions at this point? So then, if you want, Lonnie, we can move on to the audience section. And this is where Tim was alluding. And again, I know this could be controversial in our state, but again, this is one of those things that's coming through pretty loud and clear with the unions, the requirement of making sure that there's some sort of mechanism where patrons are having to, at the very least, complete a self-awareness survey, but there's a lot of conversations about testing. We'll see where that goes, so that people who are exhibiting symptoms are not admitted. Now, there's the logistics side of that. I realize we need to figure out, what does that mean? So I keep bringing up on these conversations, so you've got a family of 4, one parent presents with symptoms. Is the entire family of 4 being sent away? Or are you letting the other 3 in, knowing that they're probably just earlier in the cycle, so they're asymptomatic so far, but they're probably carrying it? So we need to come up with what those policies, how exactly that's going to be executed when you're talking about group, because it's very unlikely the entire group is going to test positive, right? It's more likely going to be some subset of that group. So we need to wrap our arms around that as an industry, but that is what it looks like may be right now is considered a requirement, but we're still negotiating. So that will continue to be a part of the conversation. Mask wearing is definitely something that is very high on the list. And I think as long as we're asking people to sit shoulder to shoulder, in this current environment of how we know the virus spreads, I think mask covering or face covering is going to be important. It is going to be required. Right now, if we're talking shoulder to shoulder in our main audience chambers, that means that those masks are on 100% of the time, which, as Tim alluded to, that's an impact, right? Because we're looking at, as we're working on our budgets, that means no concessions for the entire year, which is a huge hit to our revenue. We need to figure that out. But when you're in a socially distanced environment, I can see some venues are doing the once you get to your seat and you're not moving around people anymore, you can take your mask off. But if you're sitting right next to strangers, I don't see how that mask can come off right now until there's a vaccine or something else that's going to help keep people safe. So that's going to be a really tricky one. Another interesting operational standpoint that a lot of venues are talking about is this possibility. The last bullet under audience is, do we consider some sort of staggered entry? So, and this kind of folds into the testing. There are some conversations about maybe the way when you do your testing, you get assigned an entry time. And so you're not having you're not having half of your audience show up 10 minutes before curtain and you're trying to squeeze them all through, right? You're actually trying to stagger that. What's in here, again, as Tim said, is very, very loose. So it may be instead that kind of like we've seen some of the grocery stores and some retailers do, where you have a window of time that's in advance of everybody else for the segment of your population who deems themselves higher risk. So whether that's because of age or health condition, they have access to your venue maybe 15 minutes to a half hour ahead of everybody else so that they can kind of get through the doors and get closer to their seats. There's a lot of negotiation that goes into that too, though, because as I've been having these conversations on a national level, I've been saying if we're going to open doors to the lobby early, really, if the goal is to prevent crowding areas, that means we need to have access to open the doors to the theater early as well. So this, what the unions and so many shows are used to, of only letting audience members into the theater chamber a half hour prior, may not be realistic if we're opening our lobby doors early. So again, that's going to a little bit be venue by venue to figure out what is the size of your lobby? How much room do you have to spread people out? And do you need to have that conversation with the artist to say, this is going to go hand in hand, and I need to get the audience in the lobby early, and I need to be able to move them into their seats early. So it's something that I think is important for us to be thinking about, but it's certainly going to be a conversation based on your venue setup. So there is a lot packed in those 4 little bullets. So I think it's good to kind of take a time out there and see if there are more questions. Let's see, so someone wrote in, yeah, so this question about if you have confrontations with your safety manager, whoever is having those conversations with the community. I don't know how many of you already have some form of security and or police presence, but to me, I see that very similar to any other disturbance. So whether the person is becoming combative because of a COVID-related issue or because we won't let them carry in their bottle of wine or whatever the case may be, once they start to escalate it and become violent like that, I do think in our venue, we would look to channel that the same way we would handle any other patron that became belligerent toward our staff. So that's how we would look. Yeah, and that is a really important reason why you need to make sure that you're involving your different levels of community. So meaning if it's your city police versus your own in-house security team, you need to make sure that they're on the same page and that they're going to support what you've got in place. And so that communication will be really important. I know our police department has been very, very good They've been great partners when it comes to just helping to be that backup for us. They understand our policies and are there to help us reinforce those, because, you know, even though it's a performing arts center specific policy, not necessarily a City of Appleton law, right? It's still within our rights to create those rules and to enforce them. Hopefully that answers that question.
David, go ahead.
Just to kind of piggyback on what she was saying, whether or not local law enforcement is really behind it, you know, there's been a lot of county sheriffs that, so they're not necessarily going to enforce it, but once they decide that they're not going to obey your rules and your policies, then it's technically trespassing and they can't enforce that.
Mm-hmm. Yep. Yep. The question about how do we avoid the mass medical excuses, you know, it is interesting. And again, I think this will sort itself out. This whole idea of HIPAA privacy around the masks is actually not true. So it is one of those things where, again, we are within our full rights to require a mask, and we can ask. If someone's saying, I'm sorry, I can't wear a mask, this is a situation where it actually is okay, as far as my understanding is. Now, of course, we will have a whole lot more legal vetting before we go through, but I don't believe that this falls under HIPAA the way some are claiming. So I do think we have a little bit more latitude than what you may get the impression from some of the social media posts out there and that sort of thing. I think that there is more ability to enforce that than what some would have you believe.
Thanks. Great questions. Anyone else?
Mm-hmm. Oh, Karen?
Yeah, hi. So Karen Geschko, Arts Board, and thanks for doing this.
Yeah.
Just curious if it's falling at that point when people say I can't wear a mask for health reasons, if that becomes an accessibility issue. Because I'm hearing some conversations where people are saying, look, it's going to be our rule. If you cannot wear a mask, you need to not come to our venue.
Mm-hmm.
The end. And I'm hearing others say, you know, the rule is the mask, but if you cannot for health reasons, then we have an area set aside in our audience, the seating area, where you can sit. And your tickets will be there. It won't be mixed up with other people who will be wearing masks.
Yeah.
And I'm just curious about that conversation, those two.
Yeah, and Karen, I have to admit, I don't have all the answers on that one. I think that that is still working its way through legal, if it will fall under ADA or not. So I think that there are some questions of exactly what would qualify someone for having a health issue that would legally fully preclude them from wearing a mask. It's not the it's not necessarily just the tactile issue. So that is still being worked on, and I think there will be more to come on exactly how we can handle that. I can tell you, you know, I think all of us will have to struggle with, I don't see a way to safely have a patron in the building without a mask, with the caveat of depending on the testing that is also in place, right? So if we've got the ability to do some rapid response testing that that we know is accurate, maybe then I'd be a little bit more comfortable with a section that is kind of away from people. But at the end of the day, we know, based on what we know today about how this spreads, you're not going to have them far enough away unless you've got like a crying room sort of situation, right? And if venues have crying rooms, then great. Maybe that's your easy solution. For venues that don't have crying rooms, we're going to need to come up with something else. So I think that's an excellent question, Karen. And I think how ADA impacts the mask wearing is something that's still being worked through.
Yeah, thanks.
Yeah, great question. Any others? Okay, so then if we go on, the last part of this sheet starts to deal with some of the issues as it relates to our employees and back of house. So again, and hopefully we're all already doing this, that employees who are sick should be staying home. And I know as an industry, pre-COVID, this is always a tricky thing, right? Because we've always said this: if you're sick, stay home. Don't make our audience or our staff sick. But we have so many very, very passionate employees that they try to push their way through anyway. Well, now it's absolutely, there is zero tolerance. So making sure that if they're sick, they're staying home. There is a lot of conversation. This is where artists are still, so far what we're hearing, especially from Actors Equity, a little bit from IATSE, is even though they've already put the demand on the table for at least weekly rapid response testing of everybody who comes in, who would possibly come into contact with the actors, they still want temperature screening in addition on a daily basis. Personally, from every medical professional I talk to, they say the temperature check is not a good check, a good way to screen, but it is on the list still. So I'm always fighting to have that one removed. Right now it's still on there. We'll see how that evolves. And then again, some sort of wellness survey, which may include testing. The same hygiene policies, the same PPE requirements that we've seen in other areas. What I think is interesting here is that there's a lot of conversation about, once actors especially are in hair and makeup, are they still required to wear a mask until the minute they cross the threshold from the wings onto the stage? Or once they're in hair and makeup, do they no longer need to wear a mask or a face covering? So it's very interesting to me that for as stringent as Actors Equity has been, this is an area where they're wiggling a little bit. And again, some of these shows, they're in hair and makeup a good 45 minutes before curtain, and I just can't imagine them wandering around backstage without any face covering. So I anticipate that still being worked out. And the orchestra pit is a huge, huge area of concern, as I'm sure all of you are dealing with. So there are a lot of different things that are being investigated there. Some of this may depend on your venues. Again, I've had some Broadway shows have asked questions like, well, do you have a separate space where the musicians could perform in a separate space and we just pipe the music in? And we've actually done that with shows pre-COVID in some instances, right? So it's not unheard of. The big concern is when you have touring shows where the musicians are not self-contained. So you've got the touring musicians and then you're mixing in local musicians, and there's a lot of concern about how are you keeping these two groups safe within each other and as they intermingle. So you know, one of the first ideas out of the gates, again, that you all may have talked about when you had your conversation prior, is one of the very early solutions is we're just going to put a plexiglass lid over the pit, and that will protect the musicians from what's coming out of the actor's mouth. It'll protect them from the audience, and it will protect everybody from what's coming out of the pit. Very quickly, sound engineers said, whoa, 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 wait a minute. You know, plexiglass is not easily penetrated. It's going to impact your sound. So there's a lot of different scenarios. This week, they're actually testing a prototype of like a little pod, which for those of you who are like me and watch movies like Spinal Tap, it's hard for me to have these pod conversations without cracking up, but there is this pod experiment that's going on that would put musicians each in their own little tent, for lack of a better explanation, that they would have to carry with their instruments. They would be responsible for cleaning. The shows would have to provide. But again, what does that mean for local musicians? Nobody can answer that question. So pit remains, and you know, just like our orchestras, we're all dealing with a lot of mysteries around how the pit is going to work exactly. I think the big thing is, as a building, as you're having your airflow conversations about the audience chamber, having that conversation about your pit is also very important. And if you have a separate air handling system for your pit and you can increase the airflow there even beyond what you're looking at everywhere else, that's going to be to your advantage. So the more you can find out about that section of your building and how you can push air through it, that will be very helpful to you as you go forward. But the pit is still admittedly an area that is a big concern, and there aren't a lot of solid answers yet, just a lot of theories being tested.
Mhm.
The other interesting thing that is the no visitors backstage. I think that's pretty not a big surprise. That probably isn't a big surprise to anybody. I think what we'll find is we're all used to what I would always, you know, call our diva shows, where you had to have that conversation with the staff beforehand and say, okay, do not go backstage. I think we're going to have to be really vigilant with our staff to make sure that only the personnel who need access to backstage are backstage. I think that shows will be watching that very, very closely. And then the other interesting thing is just this idea of how are we serving meals. The unions have actually taken off the table, which is shocking to me and a little concerning. You know, like the communal coffee is off the table. They don't want communal coffee, which I hope they're bringing their own, because I really don't want to deal with them not caffeinated. It makes me a little nervous. But you know, all of those communal things that we would do, our breakfast bars for load in, those are all going away. Everything is going to need to be individually wrapped, self-served as much as possible. So buffets are going to go away. We're going to need to provide box meals. So as you're looking at your budget allocations for meals, whether it's for your cast, your crew, whatever, you're going to want to make sure that you're taking a look at those budgets and allocating for box meals as opposed to buffet. So again, this is a very, very high level that can be used as a template then. Hopefully, I don't know how many of you are working with other consortiums out there. There are a lot of plans that are much more in depth with this, but this is an attempt, as Tim said, to stay very high level so that we're able to be proactive. We're able to have some similar guidelines that we're all talking through while allowing for the individual uniqueness of each of our businesses, each of our buildings, so that we can drill down into this and get to the level of detail and specificity that we need to actually execute this plan. So first, any questions about the employee backstage portion, or then I'd open it up to your thoughts in general about the entire concept.
And Maria, can I share this document with the
Yes.
Wisconsin Presenters Network? Okay.
Yes, please, please.
After the meeting. Okay.
And Lonnie, I'd love to, right now the stage that we're at is just this week. This plan went to Actors Equity last week, and then this week it is going to IATSE and the Musicians Union. So as this evolves based on that feedback and continued learning, I'd love to, with Amy's help, keep you updated and therefore the group on any significant changes that we hear from those groups as we have them weigh in on this as well. So far, the document you're looking at has been developed by the producers and presenters. That's who weighed in on this side. And so now we're just trying to get that other side in to buy into it as well.
Great. Questions, Tim?
Yeah, so we're not going to open until there's a vaccine anyway. Do we have to do any of this? That's the question. No, but seriously, that's a conversation.
Yeah, it is the conversation.
Is this changing our world forever moving forward?
Yeah.
You know, like security did at some point in our lives, right, with 9/11. But,
right.
You know, there's a vaccination. Audiences are going to come back. People get all vaccinated. Do we have to bother with any of this anymore? That's the question.
Yeah, I think it will be interesting to see, right? I think hopefully, I'm a little concerned about this idea that we can't reopen until there's a vaccine, because again, that feels more reactionary, less control, and that time horizon seems way further out. I'm really hoping we can get back to earning some money before then, in a safe way, because it has to be safe. But I think your point about the vaccine, I think once the vaccine gets found is in wide distribution, because you need both, right? Then I think we'll be able to start to relook at this. I think the trick is that a question is, how long is it going to take us to come up with a useful vaccine? There's a lot of question. It's so hard to be on these calls sometimes because you feel like you just keep getting knocked down. This concern about the antibodies only lasting 3 months or less really makes me nervous about how long is a vaccine going to be good for, and you need it to be in widespread use. So we need to hit that tipping point where the majority of, well, almost everybody in the community is getting the vaccine in order to really make dramatic changes in reducing some of these things. But I sure hope, Tim, that this is a short-term thing. I hope that masks or face coverings on everybody 100% of the time that they're in our walls, I hope that's not a long-term solution, because again, it creates a huge impact into not only the experience of the event, because now you can't sell the the wine and all of those other things, but it also changes. There's a lot of events that we would do in our building that are really food and beverage centric that now we can't even do if face coverings are required 100% of the time. So hopefully we will see these things loosen up once we find a successful vaccine and everyone in our community, for the most part has it.
And Mary had a follow-up question.
Yes.
You said this is designed for 100% capacity. Is 100% capacity realistic before a vaccine? That's the million-dollar question.
It is, and that's going to be audience dependent, right? So the point of this is we want to have the ability to sell people shoulder to shoulder and start filling the house like we normally would. But I think there's a really good question of, will the audiences come back at that level?
Well, and will mandates allow it? Like one of the things we want to do is help push the mandate to allow us to go to full capacities, as opposed to that being reactive to say, okay, you can't go to a full capacity unless there's a vaccination.
Right. Yeah. And
but we're saying, right?
Yeah. That's right. That's what we're trying to say is, hey, if we put all of these protocols in place, Tim and I, along with Kendra, who is with the Market Center, we had a conversation with the Wisconsin Medical College epidemiology team to say, if we were putting these things in place, are these the responsible steps that we need to put in place to do everything in our power to mitigate the spread, allowing for a full house. And what I really mean by that is shoulder to shoulder audiences, right? And so we had that on the state level, we're having that on the national level. I'm having that conversation with my local healthcare providers, and for them to buy in and say, this is really the best plan to be able to, yes, you should be able to safely get a bunch of people in a room sitting right next to each other for a longer period of time if all of these things are in place. That's what we're looking for, as opposed to saying, nope, even if you do all of this, that's not good enough. What I'm hearing so far from epidemiologists is, yeah, you know what, this is the responsible approach. Again, not as the numbers are spiking, but if in your community you've managed the spread, then this is a good way to reopen prior to vaccinations being available that will keep everybody in the building as relatively safe as you can, right? And that's what we're looking for. And again, we can start pulling it back once the vaccine comes around or whatever other change happens that this virus starts to be less of a threat. Let's see. So hopefully, Mary, that answers your, oh wait, you were talking about, the mathematical excuses, we covered that. So Melissa, you had the question about, the wind ensembles, the symphonies. We're having the same conversations with our symphony about how to perform safely. And again, I think there's a lot of theories out there that I have heard and that people are testing. One thing that I heard with orchestras is similar. I think it's a similar material as this prototype that's being tested for the pit orchestras, that there's this material that the theory is sound waves can go through, but vapor can't, that wind instruments, brass, the woodwinds, that they could put over their bells to help limit and help capture some of that vapor air if it goes over their bells, but yet the sound can still come out. Flutes are a big issue, right? Because there is no bell. But I have heard conversations about kind of like how you see some people with the face shield. Is there something like that a flutist could be behind? So I think that there's a lot of conversations that are happening, but they are kind of unique to the instruments and the situations facing those instruments. the difference between when you've got people in a pit is, again, you can put them in a tent and nobody's the wiser. It would be really, really hard to watch an orchestra on stage. I'm sorry, and it's not funny. It's just a Spinal Tap thing. I've got to stop. But you know, picturing all these little pods on a stage with mystery sounds coming out of them, I think it definitely is harder when you're talking about viewing musicians on a stage. They need to still be viewable in a different way. So there's a lot of things being tested. There's a lot of science that's being pushed, but I think everybody's really struggling with that. You know, it's our musicians sitting next to each other on a stage with that much vaporized air flowing through is a real concern. And then how does it permeate out into the audience? So we hope that the science catches up pretty fast. I know we're working with our symphony locally. What they're looking is right now probably doing a few virtual things for the rest of this calendar year so that they can spread out and be in different rooms, so that they're kind of keeping the groups together, but spread it, but not the full orchestra on our stage. And piping sound in and mixing it in that way. The in-person thing, I know that they're right now, I think kind of holding, they're not going to be right out the gates in January. They're not going to be the first thing on the stage, and just hoping that they can find some ways to contain that wind while still letting the sound out. Yeah, brass clearing their instruments. There's been a lot of conversations, yeah, whether it's cups or, again, whether there's something that's actually closer to the instrument for when they're clearing it out. Yeah, I don't have the answer, but I know that there's a lot of conversations around those issues.
Mary, you got your hand up.
Yeah, is anyone clear on, so let's say you're a smaller theater that's looking to do shows at 50%, and maybe it's a smaller show, not a big symphony. How does the new mask mandate apply to small performances? Like, I'm very curious, Kim, if you guys are still doing Be Twins, can you have two people on stage 6 feet apart singing unmasked? Or how does the mask mandate apply to the performers? I know there's that little clause about single speakers.
Yeah.
I have not been able to get a firm definition of how that applies to performers.
Yeah, Mary, what we're doing right now is we're really just watching the community reaction to the tickets being on sale. But we're also, as we're watching numbers in our area are increasing, though they're not going up. We have a healthy, I guess, not healthy, but healthy increase in cases. I guess the show's a little bit up in the air as to whether we'll have it. But definitely, I'm hearing things that we haven't exactly thought of in this way. So that's definitely something we're going to need to find out how we're going to handle.
Yeah, and I don't know specifically how the state law applies to it, because like you, Mary, I saw that if you're an individual speaker, you can take your mask off while you're doing your speaking and put it back on. I know that there was one performance that was approved to take place in Massachusetts, approved by Actors Equity to take place in Massachusetts. And they were getting really creative with the mask, that the mask was only coming off when they were doing their part. And then they were figuring out ways to kind of do the blocking and the staging, everything, so that then they were putting it back on as soon as they were done. So I don't know if there's a way, but definitely the socially distancing is going to be a must, but I don't know if there's a way to work it out. You know, duets, of course, are tricky in that way, but yeah, it's going to be interesting to navigate.
Yeah, Mary, if you read the frequently asked questions of the mandate, it does say theatrical performances can be performed without masks as long as they stay 6 feet apart from each other. And if you're curious, I would ask Matt at the Meyer, because they did move forward with their performances of the Frank productions this past weekend. So I would ask how that went.
do all of these guidelines, I mean, do these seem pretty much in line with what you are already thinking for your venue? Is this a helpful guide as you think about how to safely bring your audiences in at those higher capacities, driving toward eventual full houses? Does this seem like the same set of things or things that make sense to all of you to help guide your process creation? I think the interesting thing about Wisconsin is we don't have any coordinated leadership at the state level, which has often had me kind of feeling uncertain how to proceed, the best way to move forward. But I am curious, as I watch what's happening across the country, there are some states where they have created something like this, but more in a letter format that then all of the venues have signed on to and then sent it to their state representatives to say, here's what we want to put in place. We would like your blessing to endorse that this is happening. And I'm curious if this group would be interested in moving forward in that sort of direction, again, so that we can kind of be in the driver's seat with our representatives to say, look, we've, you know, and I think that we can put in that letter based on consultation with the Wisconsin Medical College, and now I can add a few, if we can add some of that in, we've had a conversation with healthcare providers. They endorse that these are excellent steps. We want to follow these steps and get your blessing that once COVID is under control, this will allow us to reopen without limits to our capacity. Is that something that you all would be interested in being involved in?
Some bobbling heads.
Excellent. Excellent. Well, like I said, with our cases still on the rise, today probably isn't the day, but I think we can be working behind the scenes to create something like that so that as we get back on the decline side of this, this can be something that we can position. And I know our state legislators technically are off now for the rest of the calendar year, but I do think that through the health department and some other ways, there's still a way to keep this conversation moving forward and to try to build some momentum as the COVID cases hopefully wane after the school year starts.
Mary, you can go ahead, Mary.
I'm kind of backtracking here to the mask conversation. So I don't know, Maria, if you can clarify, and I know you're not the, you know, the legal answer or anything, but if anyone else knows about this, because I have heard conflicting things about the whole HIPAA issue. So even, let's say not relative to a performance, you have a visitor come in your building for whatever reason, they say, I'm not wearing a mask because I have a medical reason. Are you implying that we can ask them to tell us what that medical reason is? And would it be perceived as, does anyone know if it would be legal or illegal or anything to say, if you're telling me you can't wear a mask in my building for a medical reason, I'm going to ask you just to sign here that you stated that with your name and contact information so we know who was in our building without a mask?
I would think, Mary, that second is a very safe option. I also think, I think asking them, well, tell me what your condition is, that may not be allowed, right? That's probably where the HIPAA violation, but if you say a mask is required to enter our building, so I'm sorry, if you won't wear a mask, you don't get to enter, that's where I think you are within your rights to say that. So I think that I would encourage you to check with your own legal just to make sure that they're comfortable with it, or your board or whomever is appropriate. But it seems to me that I like that idea of, if you decide to waive your mask requirement and let them in anyway, that yeah, you're checking their information so that, again, because it is partially a liability thing too, right? Mm-hmm. So unfortunately though, we have to be careful with the liability right now. There are no protections from liability. So that's another thing that we're working on. That's another thing with this is if we say, as we're driving these state conversations, to say, P.S., if we're doing these things to the best of our ability, will you limit our liability exposure? So that's another conversation that I'm having both on the state and the national level. But I think that that's something you'd want to consider. I do think that it would raise red flags if you say, well, what's your condition? Prove it.
Kim?
Yes, Kim?
Hi, thanks. If we have just asked all of our patrons to come in and they're to wear a mask so everyone feels safe, I just don't understand why that one person gets to do exactly what they want.
Right. Yep.
It's a business transaction. You want to come in our building, you're going to wear a mask. If not, you're out.
Yep.
We can't, if we're shoulder to shoulder, I don't even see how that person who's sitting there unknowing that they're carrying, has touched something on themselves, puts their hand on their armrest. Now you're sharing an armrest with Joe Stranger, and Joe puts his hand there and then touches himself. I just don't understand how we're all safe.
Yeah. Yeah, I would lean toward, if you can't wear a mask, you're not allowed in right now in this current environment. But as was alluded to before, I think maybe from Karen, there is still some legal vetting that's going through to make sure that there isn't an ADA line that we're crossing there. But I agree with you. I think that there's a perception too. And again, I don't want to get into, there's so much bad behavior out there. I just can't even wrap my brain around. But if I were an audience member with my family in tow and we're all wearing masks and all of a sudden now somebody sits directly behind me without a mask, I'm uncomfortable, right?
Right.
So I think that, yeah, we need to think about that whole experience.
If someone is cognitively disabled, aren't they exempt from wearing a mask?
I don't know that.
I mean, I don't think they are. I mean, I think they are.
Oh, Karen, do you know?
Is anyone, so the aging and disability resource centers that are in every county might be a really good resource for y'all to tap into on that one. So that's part of DHS, but if you just type in Aging and Disability Resource Center, we're gonna try to get some of that stuff up on our website, but don't wait for us. So that might be a good resource. I also wanted, before I jump off, just to see if anybody else is gonna be doing the pandemic response for performing arts organizations. That starts in 5 minutes. It's a webinar by somebody else that I'm jumping on. I'm not seeing this. Okay, I'll see if I can get a recording, and if it's worthwhile, I will send that link out on the WPN website.
Thank you.
Great, thanks, Karen.
Thank you.
Thank you for having this.
Yes, thank you all so much again for inviting me to share this information. I would be very, very interested in your feedback and your thoughts, and I'd love to stay in the conversation as we continue to evolve this, and I'd love to find a way for us to present this forward. So again, we can kind of take control of the state conversation about how we can reopen to higher capacities. So more to come on that front.
We have Mary and then Tiana, and then we'll wrap it up. We've got about 3 minutes left. So Mary, you go ahead first.
And this is, again, just an extension of that and another thing to think about. One of our dilemmas with the whole mask thing is, in addition to performances in the theater, we have a beautiful space that we rent out for meetings and weddings and things. And we have continued doing weddings at a reduced capacity. And as of last week, told people with events coming up, everyone has to wear a mask. And then there was some discussion about, well, this isn't really like a, Shower presents hosted event. This is a renter. So does the renter have any influence on what they do? And I said, but it's still our building. But that's where it gets even touchier to say, if you're not going to wear a mask, you can't come in when it's not an event, that we chose who to invite. It's just a slightly different animal.
My understanding is right now, even though it's a different person responsible, I think both parties, as it being your building and their event, you're both liable if something were to happen. So in order to protect your building, I think your rules still apply. I know we have, unfortunately, because of this, out of consideration of this mask face covering requirement, we have completely stopped taking any bookings for any of those types of events, because I don't know how you do a dinner or wedding or anything and enforce the mask face covering thing. But you're right that we're so used to kind of handing over a certain amount of control to our other renters. But in these cases, if something bad were to happen, the building still can be held liable right now.
Tiana, you'll be the last comment then.
Maria, I have a question about looking at the artist, and they perform in the venue and leave, and they test positive for coronavirus. I'm looking at the sense of the liability around it to make sure that the venue doesn't get the bill for medical issues, because what if they do blame it on the venue? So is there, I mean, are you looking at rewriting the liability? Because I know we're looking at making sure that the artist has insurance, liability, whatnot, but what if, do they test positive? And I don't know how they could even prove it, but
Yeah.
just looking at that kind of.
Yeah, so part of this goes back to the testing. So the conversations that have been taking place is with the producers and the presenters, we're trying to negotiate that there's kind of this line of the show is responsible for all of their people, the building is responsible for all of our people. And we've got to be able to testify that our people are not infected, so we would need to supply the appropriate testing, PPE, all of those things for the building related people, and the shows would be responsible for doing the same with their teams. And that way, hopefully, we're by promising that we're doing that, we're taking that liability. We will not blame each other if someone gets sick, because we were both doing our thing. So that's what we're trying to negotiate right now. So we're each responsible for keeping our teams healthy, and we can't point the finger at each other if someone were to come down with it. We're not, admittedly, again, that's the phase that we're at in trying to negotiate all of that, but that's what we're trying to get. And as Amy and I and our team, we're working on adding language to our riders, and there's a couple different language points in those riders. One is redefining what force majeure means, as we all learned in March. And then the other is this whole idea of that liability of, if you come into our building, you need to follow our procedures and you're entering at your risk.
Great. Well, thank you so much, Maria, for taking the time, and definitely, please, through Amy, keep us updated. It'll be very interesting to see how things go on. So yeah, thank you so much for your time, and thank you, Amy, again for the suggestion and the recommendation to invite Maria here. It was a great conversation, so really appreciate it.
Yes, thank you so much, everybody, and we will certainly stay in touch on this issue.